Good morning or afternoon now, and welcome to today's webinar on global health, on the Global Consortium on Climate and Health Education. My name is Dorothy Bibberman, ASPPH Director of Global Engagements, and I'll be your moderator for today's webinar. Today's speaker will be Ms. Brittany Shea, Project Director for the Global Consortium on Climate and Health Education, which is based at Columbia University Mailman School of Public Health. The consortium is a global network of health profession schools and programs developing climate health education for the next generation of health leaders. Previously, Brittany worked to advance research on environmental health and climate change in other roles at the Columbia Center for Children's Environmental Health, Harvard University's David Rockefeller Center for Latin American Studies in Santiago, Chile, and the Harvard Business School. Brittany has presented on climate health education and environmental health topics, and she received a master's degree from Harvard University and a bachelor's degree from Boston University. Thank you, Brittany, for being with us today to provide this overview of the consortium. Before we get started, just one housekeeping item. At any time during the webinar, you can ask a question by submitting it in the questions field on the right side of your screen, and we'll review the questions at the end of the webinar. And now I would like to turn this over to our presenter, Brittany Shea. Brittany.
Okay, thank you so much, Dorothy. I'm really excited to be here and have the opportunity to present about the GCCAG to the ASPPH. And today I'm going to talk about what the Global Consortium on Climate and Health Education is and the benefits of membership. Let's see if I can, there we go. Okay, so basically, what's the rationale for climate and health education? Which I'm guessing there are many people that are on this call today that might have some idea of why climate and health education is important. And so let's see if I can advance. Okay, there we go. So the health impacts of climate change are numerous and serious. So there are heat-related illnesses and deaths, injury and death from severe weather, asthma, cardiovascular disease from air pollution, spread of viruses and infectious diseases, malnutrition and disease from impacts to water and food supplies, and mental health impacts, and forced migration and civil conflict. And these are just some of the examples, and the impacts are expected to worsen in the future. Let's see. Okay. I'm having a little bit of trouble with the, okay, there we go. The role of health professionals. So there is an imperative for quick action on many fronts as a result of this. So we need to recognize and respond to climate health threats, prevent climate change at its source by reducing heat trapping greenhouse gas emissions, support greener health systems throughout the economy, and understand the health co-benefits of adaptation and mitigation. And then we also need to communicate effectively about these issues. So what is the role of health professionals in all of this? Well, climate change is impacting health, and health professionals need preparation for what they will need to handle. So we've kind of organized 4 different roles here. So for public health, there's the population level interventions for prevention and mitigation. And for health systems, preparation for climate related health events and decrease in carbon footprint, clinical care for climate related health impacts, and science to advance knowledge. However, there is a knowledge gap. The climate and health field is still young. There are a modest number of experts, significant gaps in knowledge, and few developed educational programs or curricula in health profession schools. So George Mason University published several surveys of physicians' perceptions of climate change, and a large majority concluded that climate change is happening, is driven by human activity, and is relevant to patient care. And a majority were already observing health impacts of climate change among their patients. And they were most commonly as increases in chronic disease severity from air pollution, allergic symptoms from exposure to plants or mold, and severe weather injuries. And then another survey that they did cited significant barriers to their physicians engaging on this issue. And that included a lack of time, uncertainty about how to communicate it, and lack of resources and recommendations for patients. But health professionals are critical groups to be educated on this topic because of the threats, not only because of the health threats of climate change, but also because they're one of the most accessed and trusted sources of information about climate change. So this brings us to the Global Consortium on Climate and Health Education, or the GCCAG, which was formed to help bridge the gap in knowledge on climate and health among health professionals. And so the consortium is what we're calling the virtual town square for climate health education. And it's the place that all of these different health professions institutions can come together and discuss the topic and share resources and best practices. And we're based at the Columbia University Mailman School of Public Health. That's where our secretariat is. So on June 6th of this year, it was announced that ASPPH joined as the first association member of GCCAG, which we were really excited about. And so these two groups will work together to advance climate and health education, including by connecting with other associations, sharing educational resources, and promoting climate health content with the Council on Education for Public Health, or CEF. So our vision and aims, our vision is that all health profession students will be trained to prevent, mitigate, and respond to the health impacts of climate change. And our aim is to obtain commitments from health profession schools and programs across the globe to educate their students on climate and health and other planetary changes, to bring together the institutions to share best practices and scientific information, to develop global standards for knowledge and practice on climate and health that all graduates should possess, and share resources that the institutions can use for this purpose. Also to build a pipeline of health professionals who focus on climate and health, and then to support the development of global academic partnerships to foster mutual learning, particularly in under-resourced countries. So the GCCAG has a really interesting background. So first of all, we leverage the expertise of the Columbia Climate and Health Program, which is based here at the Mailman School, and that was launched in 2008. And the GCCAG was born from a meeting at the December 2015 UN 21st Climate Change Conference of the Parties, or COP21 in Paris. And during this conference, the Mailman School partnered with the White House on a special session to highlight the need for greater investment in the study of and planning for climate and health. And this was also recommended as an essential global action by the World Health Organization. So for our structure, we basically have 3 different leadership groups, and then we have our membership. But so we have the Global Advisory Council. They provide high-level strategic guidance. We have the Expert Coordinating Committee, and they're really focused on climate and health training and working with us on educational aims and curricula. And then we have our Climate and Health Program Science to Education team. So here's a listing of our Global Advisory Council. You can check this out. This is all on our website. But Linda Freed, Dean Freed is the chair of the group. And then we have several other individuals from different institutions, from the private sector, foundations, et cetera. And here's a listing of our coordinating committee. Again, we have several people from universities, and then we have some people from the NIEHS and CDC. And here at the Mailman School, we are led by Jeffrey Shaman, who is the faculty lead. We have an external faculty advisor, Kim Knowlton, who's based at the Natural Resources Defense Council, and then myself. So for our activities and services, so these are activities that are provided, many of them for members, but also some of them, a lot of our resources are available to the public as well. So like I said, we're a virtual town square for member institutions to engage on climate and health education. And one of our main goals, as I mentioned, was to obtain commitments from health profession schools around the globe to educate their students on this topic. And so now we have almost 200 institutional members from almost 30 countries on 6 continents and representing institutions with an estimated 150,000 students. And members participate mostly through webinars, our website, through email, and our webinars provide opportunities for members to discuss strategies, challenges, and success stories for integrating content into curricula. And so our baseline survey is something that we conducted towards the beginning of when the consortium started. And we wanted to establish a baseline to better understand what the current assets and needs were of our member institutions. And we actually have a manuscript written up that we are going to publish, and we'll hopefully have these results out there soon. But some preliminary results show that we had about a 53% response rate, and 84 institutional responses were collected out of 160. And out of 84 respondents, about 63% offer climate health education. And it's most frequently as a session during a required core course, or a standalone elective, or a session during a non-required course. So another main goal of the GCCAG is to provide the resources for members to implement their commitment. So a major service that we offer for members is this living knowledge bank of climate health educational guidelines and curated curricular contents for all health profession students. And they're selected by a global committee of experts in the field, and they're freely available online. So we found that there's so much content already out there, and we didn't want to reinvent the wheel. So we wanted to bring together all of these resources in one place. So the Knowledge Bank links out to resources that are already publicly available, like slides, videos, and online courses, and they're all indexed by impact area within a larger climate health teaching framework of core competencies. And so this is designed so that institutions can use this information and integrate it in the best way for their own institution. And so another main goal was to develop global standards for knowledge and practice on the health impacts of climate change, and share those resources. So we've started efforts to promote climate and health in licensure exam questions and credentialing criteria for schools. And then we also included in the Knowledge Bank have a set of core competencies. And these are recommended for all health professionals. And they were developed with our coordinating committee and advisory council. And we wanted to address the question of what students need to know. So The competencies are, there are 16 of them. They're across 5 areas of practice, and they include, for example, an understanding of complex environmental systems and methods for measuring their impact on human health, climate health knowledge for the public health and clinical practice, understanding of political and communication aspects, and then in addition, understanding how students can be proactive in improving the environment through climate health activism and policy engagement, including promoting healthy and more sustainable behaviors in the clinical setting and reducing the carbon footprint of healthcare delivery. So if institutions want to begin to add climate and health content, they can go to the knowledge bank and they can see some slides that are indexed by topic area, and that will help them to integrate this content into a module or a course. And the competencies can provide an outline of what that information should include. So GCCHE also brings together member institutions to share best scientific and educational practices on how to integrate content. And so we hold, as I mentioned, member webinars, and they provide opportunities for members to discuss how they've integrated content, what they have, who they've worked with, and what materials they've used to do this. And we also gather and share strategies and methods from members and our coordinating committee. And so all of the strategies and methods are important. So institutions can start with one, like getting some climate and health content into existing courses, and then they can develop a climate health course offering. And then ultimately they could have it integrated throughout the academic program. So one strategy is infusion into existing courses. And if you add a few slides into every course, you can reach everyone. So that's one strategy. Another strategy are creating electives. So this attracts people that are really interested in the topic, and they can become what we call champions for this topic. So one example is the climate medicine elective at the University of Colorado School of Medicine, and they found that over time, this elective offering has really attracted students that are really passionate about the topic. And another strategy are fellowships. And there's a new fellowship that was created, a collaboration between the University of Colorado School of Medicine and NIEHS and the CDC, and it's a fellowship on climate and health science policy. And then lastly, establishing projects for students on research and activism that they can do at the institution and that are linked with incentives can be helpful. And students can work with professionals in the field to see how climate and health information is used in practice. So one of the other things that we're doing is we're really just broadening the reach of climate and health. So the consortium has been included in high-level education guides, reports, and we've interacted and worked with a bunch of different groups. And we've presented at conferences and published papers, talked to the media. So we've been in the New York Times, Wall Street Journal, the 2018 Lancet Countdown on Health and Climate Change brief for the USA. And so we're really getting the word out there. We're trying to just increase our reach, which is helpful. And so the Lancet report, the 2018 Lancet Countdown on Health and Climate brief that I mentioned, they identified the education of health professionals as one of the top priorities for response by the healthcare sector. And then the GCCHE was given as an example of an initiative that's working to meet this need. So here's a summary of what the benefits are of GCCHE membership. So you can stay apprised of the latest climate health educational guidelines and curated curricular contents for all health profession students, selected by a global committee of experts in the field and freely available online to all. There will be programmatic opportunities to learn and share ideas about climate health education through webinars as one example. And then also to join a network of nearly 200 health professions institutions in almost 30 countries that are working to develop climate health education. So where are we going now? So, and what does success look like for us? So success is that climate health content is integrated into all health profession schools around the world. And going forward, some of the things that we would like to do are expand our membership, strengthen our partnerships with allied student and professional groups, create new opportunities for members to interact and share best practices, establish regional leadership councils, develop recommendations for members to get to different levels of implementation on climate and health, and improve our tracking of where members are on integrating the core competencies. So we want to conduct more surveys in the future so that we can have better evaluate what the status is now of schools. And so those are some examples of where we would like to go in the future. So thank you so much for the opportunity, and you can check out our website, gcche.mailman.columbia.edu, and that has, all of our articles and reports, conferences, things like that up there. So, and the way that you can join is we are asking that the head or the dean of the school sign on officially, and the form to complete it's a very quick form on our website. And that's the way that you can join the network. So we hope that more ASPPH schools will join us. So thank you so much.
Okay, thank you so much, Brittany, for the presentation. We'll now take questions from the audience, and another reminder that you can enter your questions into the questions field on the right side of your screen. So I'm going to start with the first question, which is, what is available for the GCCHE members that's not already accessible online by the general public?
So that's a great question. So right now, what is available, and in the future, we'd like to work towards more features on our website that are really just for our members. But right now, so we have our quarterly member webinars. And these are, just for members, and different schools are invited to present three schools present per webinar about what content they have available at their school and how they've gone about integrating that. And these are really, really great opportunities for schools to learn about what's going on out there, and to learn about what they can do at their own school. And so we've gotten some really great feedback from institutions about this. So that's the main, at this time, that's the main resource that's only available for members. And there's also, email communication and things like that we only send to our membership. So, the most up-to-date information and resources.
Okay, great. Thank you very much. Next question is, if you can go into more detail on how some of the resources are being used by schools and programs of public health right now.
Yeah, so what we did is like I said, we surveyed our members when the GCCHU was launched, and and member schools were joining. We surveyed them to find out what curricula they had at that point. And we're planning to do another survey to get another a sense of where schools are now. But some examples of schools of public health that have climate and health content integrated are, for example, the Indiana University Richard Fairbanks School of Public Health. They have a climate and health is included as part of a required core course for them, and it's in their Master's of Public Health degree, and it's during their Introduction to Public Health course. So that's one example, and it reaches, all Masters of Public Health students. Another example of a school of public health is the London School of Hygiene and Tropical Medicine. They, in their Masters of Public Health program, students can specialize in specific streams, and one of those is environment and health, and that stream includes sessions on climate change and health. So those are two examples from schools of public health, and I can provide more if that would be helpful.
Wonderful, thank you. Okay, next question. You mentioned that these were designed for health profession students, I believe, at the beginning. So what levels of education are really the resources geared toward? Would they be masters? Would they also apply to bachelors? And do you think any of it would even maybe be reasonable for perhaps like a K through 12 type of teaching?
Yeah, that's a great question. So right now we are geared towards master's students. So Masters of Public Health, so masters and beyond. So Masters of Public Health, schools of nursing, schools of medicine, so graduate programs. But having said that, there are some schools internationally where their School of Medicine is like an undergraduate program, and they're integrating climate and health into their quote unquote undergraduate medical program. And so absolutely, I think that these resources can be used in other contexts. And actually in the future, we would like to work towards expanding the audience so that we can reach, undergraduate, and we can reach other disciplines and even K through 12.
All right. Super. And this is the last question that I see right now. Oops, sorry about that, guys. Is, do you think that climate and health should be incorporated into existing concentrations, for instance, in schools of public health, maybe like an environmental health or a global health, or do you think it should be considered its own concentration?
I think that it would be great to have both, to have it, both integrated into the curricula for all master's students so that you're reaching everyone, but to also have something that students that are super passionate about this topic can specialize in, so they can really dive into the topic and kind of become an expert in it. I think it would be great to have both of those things.
Okay. Excellent. I do not see any other questions coming through right now. If anybody does have another question, please go ahead and enter it into the questions box on the right side of your screen. And I'll just give it a minute to see if anybody else does have any questions. Okay, and seeing none coming through, I think that means that we can adjourn, unless, Brittany, you have any final thoughts that you'd like to make on the webinar.
No, just thank you so much for the opportunity, and great to work with you all moving forward.
Okay, super. Well, thank you so much, Brittany, for the presentation and for answering the questions. And thank you to everybody on the webinar for joining today. And we've put here the information, contact information, and the website that Brittany shared earlier. So if you would like to get in contact with them, that is the way to go. And have a great day. The webinar is now ending.